Hello and welcome to Alpha Nutrition. Today we're talking about a very important topic. For women who are pregnant or planning to have a baby and living with HIV, prenatal transmission. We'll be answering questions such as what is prenatal transmission, how can it be prevented, and what are the current recommendations for HIV-positive pregnant women. So, let's get started. What is prenatal HIV transmission? Prenatal HIV transmission, also known as mother-to-child transmission, occurs when HIV is transmitted from an HIV-positive mother to her baby during pregnancy, childbirth, or breastfeeding. Transmission can occur during any of these stages, but the highest risk of transmission occurs during labor and delivery. According to the Centers for Disease Control and Prevention, CDC, without treatment, the risk of transmitting HIV from mother to child is approximately 25%. However, with proper medical care and treatment, the risk of transmission can be reduced to less than 1%. Now, how can prenatal transmission be prevented? The most effective way to prevent prenatal transmission is for the HIV-positive mother to take antiretroviral therapy, or ART, during pregnancy, childbirth, and breastfeeding. ART can reduce the amount of virus in the mother's blood and other fluids, lowering the risk of transmitting HIV to her baby. Other prevention measures include avoiding breastfeeding if safe and acceptable, replacement feeding is available, and administering prophylactic ART to the newborn. The prevention of prenatal HIV transmission begins with HIV testing and diagnosis. It is recommended that all pregnant women get tested for HIV as early as possible during their pregnancy. If a woman is found to be HIV positive, she can take steps to reduce the risk of transmitting the virus to her baby. Antiretroviral therapy, ART, is the use of HIV medications to treat HIV infection. ART can greatly reduce the amount of HIV in the mother's blood and bodily fluids, reducing the risk of transmitting the virus to her baby. The treatment is generally started as soon as possible during the pregnancy and continued throughout labor and delivery. The baby may also be given ART after birth as a precautionary measure. What are the current recommendations for HIV-positive pregnant women? According to the Centers for Disease Control and Prevention, all pregnant women should be offered HIV testing as a routine part of prenatal care. Women who test positive for HIV should receive ART as soon as possible, ideally before the end of the first trimester. Women who are already on ART before becoming pregnant should continue with their treatment, and adjustments may be made to their medications as needed. It's important to note that prenatal transmission rates vary depending on various factors, including the mother's viral load, the timing of ART initiation, and the delivery method. For example, if the mother's viral load is undetectable, the risk of transmitting HIV to her baby is virtually zero. However, if the mother's viral load is high, the risk of transmission is much higher. If a woman's viral load increases during pregnancy, her healthcare provider may need to adjust her ART regimen to ensure that her viral load remains suppressed. In some cases, women may require a change in medication or a higher dose of medication to achieve viral suppression. During pregnancy, some women may experience changes in their immune system that can cause their viral load to increase. This increase in viral load can lead to an increased risk of mother-to-child transmission of HIV. For this reason, it is important for pregnant women who are living with HIV to receive regular HIV viral load testing. Now, let's discuss the risks of untreated HIV during pregnancy. If a woman is not receiving treatment for HIV, the virus can be transmitted to the baby during pregnancy, childbirth, or breastfeeding. This is known as vertical transmission. Without any interventions, the risk of vertical transmission is about 25%. However, with the use of antiretroviral therapy and other interventions, this risk can be significantly reduced to less than 2%. It's important to note that even with all of these interventions, there is still a small risk of transmission. However, the risk is significantly lower than if no interventions were used. Additionally, the earlier a woman begins treatment for HIV, the lower the risk of transmission to her baby. The risk of HIV transmission during vaginal delivery is higher than during a cesarean delivery. Therefore, if the mother's viral load is high, a scheduled cesarean delivery may be recommended to reduce the risk of transmission. Breastfeeding can also transmit HIV from mother to child. Therefore, it is recommended that HIV-positive mothers in the United States avoid breastfeeding and feed their babies with formula instead. It's also important to note that prenatal transmission of HIV is not inevitable. With proper medical care and interventions, the risk of transmission can be greatly reduced. Pregnant women living with HIV should work closely with their healthcare providers to develop a plan for managing their HIV during pregnancy, delivery, and postpartum. In conclusion, prenatal transmission of HIV is a serious concern, but there are interventions that can greatly reduce the risk of transmission from mother to baby. These interventions include the use of antiretroviral therapy, cesarean delivery, treating sexually transmitted infections, and counseling on safe sex practices. Pregnant women living with HIV should work closely with their healthcare providers to develop a plan for managing their HIV during pregnancy and to ensure the best possible outcomes for themselves and their babies. Thank you for watching this video on prenatal HIV transmission. If you found this information helpful, please give us a thumbs up and subscribe to our channel for more informative videos like this one.